been a year with the obvious headline of the completion of the consultation and the vote to proceed with the changes proposed, which drew a lot of media attention. The CCG has been busy with a lot of things since then, and one of the main features of the year has been the increasing financial challenge that the NHS has come under.
This year we've experienced some real challenge in terms of the money. So our financial position is in a very challenged way at the moment. What I'm saying about that in the organisation is not only have we prepared for that, but we're confident about the way that we need to behave in order to address that. And there is some fantastic work going on in the organisation and across the system designed to help us to begin to work in a way that will enable us to deliver care for our patients in a way that we can afford to do that.
One of the things we're proud of is that the medicines management team delivered a savings plan last year which reduced the cost of the medicines prescribed in the community by about £750,000. It's important for us to keep a really close eye on our prescribing and keep that under regular review to ensure that the money that we spend on medicines offers the best value to our patients and the Calderdale population.
So one of my highlights of 2016 and 17 has been the establishment of the diabetes level 3 service in Calderdale, which almost every practice now in Calderdale is providing, which is a community service looking at the provision of diabetes care for patients who would previously be attending hospital clinics for the management of their diabetes. And we've seen a significant move out into the community now of several hundred patients who are now being looked after by GP and practice nurse teams supported by consultants and diabetes specialist nurses to establish and mentor practice-based diabetes teams in Calderdale.
The highlight of the year really for me I think has been our improvements in crisis care for mental health patients in Calderdale. We've successfully embedded a 24-hour, 7-day-a-week crisis service through the intensive home-based treatment team, and they're supported by a police liaison team who work with the police service, and with the mental health liaison team who work in Calderdale Royal Hospital and Huddersfield Royal Infirmary to see patients who present there in crisis with their mental health. This has provided a vastly improved service for those people in Calderdale who have mental health crisis problems.
A highlight of mine over this last year, which has been about working with people from across the sector and with the members of the public to develop our vision for care homes for the future.
Yeah, a memorable piece of work at the CCG. I guess the thing that most springs to mind is the work we've done with redesigning the respiratory service, and that we've launched a community-based respiratory service, which is making sure that patients who've got chronic respiratory disease such as COPD, chronic obstructive pulmonary disease, have got access to a specialist nursing team that can be seeing them in the community when their condition deteriorates or for ongoing monitoring, and we hope that team tries to facilitate keeping people out of hospital when they start to get poorly, treating them at home with good support, and if they do end up going into hospital, that they are able to be discharged from hospital with support earlier than they would otherwise have managed to do so.
One of the other highlights for the year for me is in Calderdale we have an exceptionally good talking therapy service, or improved access to psychological therapy service, IAPT as it's called nationally. We have one of the best services in the north of England, and as a result of this we were selected to be early implementers of an integrated talking therapy service for patients with long-term physical health conditions who also have emotional health and well-being problems as a result of their physical health conditions, such as depression or anxiety. We know that if you have a physical health condition, you're much more likely then to develop a mental health condition such as depression or anxiety, which will then mean you're less able to manage your physical health. The new IAPT service, which we're providing in Calderdale, is helping people to be able to manage the two integrated parts of their health and well-being. And this is working really successfully. I'm very proud to be part of both of them.
One of the things we're all really proud of is the work that we've done with care homes. We have an initiative called Quest for Quality, and that's been rolled out across the whole of Calderdale now, and that has had a material impact both in terms of the way people who live in care homes experience their care, and importantly the way that people who are supporting them, both within the care home and teams who support from primary care and community services, how effectively they do that support and how effectively they're connected to each other. But I'm also really proud of the way that we do things in this organisation and the sorts of conversations that we have. This organisation is brave enough to talk about love, it's brave enough to talk about kindness, it's brave enough to talk about the importance of and the power of relationship. We know that the words that we choose to use are really important. We've learned so much about that in the work that we've done in engagement and consultation with our communities about change. And we're mindful of that in the conversations that we have in the system and in the organisation. And we also know that the choices that we make are really important. And we talk about those choices. What we're trying to do here, and what we're trying to do when we are working with our partners in the system, is to create a system that's designed to improve the health of our population. A system that's designed to improve people's experience of care, to improve people's ability to care for themselves and other people with the right support. A system that does all of that within the resources that are available. A system that's designed to keep people well, keep people safe, and contribute to their well-being and happiness. One of the things that's really important is leadership, and how important it is to have a leadership across Calderdale that is aligned, that is wanting the same thing for our population. And recently a commitment has been made by the leadership working across Calderdale that we need to have a better conversation about how we generate trust and how we demonstrate our leadership effectively to our system and to the people that we serve. And I just want to say how committed I am and how committed the CCG is in playing its full part in that conversation.